Hi, I'm Dr. Kelly Starrett, physical therapist and human performance advisor for H-Wave OTC. Now, you probably have an OTC because you realize that you may need some support after a spinal surgery or a spinal procedure. Now, one of the great things about the OTC unit is that we have two options here. One is to facilitate movement and decongestion, and the other one is to create on-demand pain relief. Now, one of the problems with any time we're in and around the central nervous system is the brain tends to prioritize those things and sort of upregulate how dramatic the brain feels about what's going on here. When we have had chronic conditions and been managing painful areas in and around the spine for long periods of time, it can oftentimes be an additional trauma or additional insult into the brain or in and around the spine. So having some solutions to giving ourselves some relief after that post-surgical insult can be really, really beneficial. Now, one of the reasons we want to be thinking about how can I manage pain without sort of a pharmacological intervention or without having to take a narcotic is that one of the things we get is the added benefits of sort of maintaining our function in the life, the interactions with our family, our improved sleep, etc. But what we're really thinking about is the way out of these initial kind of surgical trauma insert is that we've got to get as much moving again in the body as we can. And if we can get some on-demand pain relief, that means that we can do things like stand up and go for short walks in our kitchen. We can roll over more effectively. We're going to see less fear guarding or less sort of guarding around the movement system. And so if you've ever had low back pain, you know exactly what I'm talking about. And if you've ever had a back surgery, I'm talking to you explicitly that when we get people some relief in terms of some of their post-surgical symptoms, we can feel better, and that means that we can begin that healing process. Remember, everything that we're trying to do here is around restoring your ability to move and to occupy a role in your family and your community and do your job. So what I'm going to show you is how we set up patients and clients that we're working with who need some on-demand pain relief. So there's a couple things here. One is we have two leads. We have a gray lead and a black lead here. And I have two choices how I'm going to set that up. So let's say that our model here, Sean, has had a specific spot here. That may or may not be where he's having pain. So we have the choice of moving above and below, but in short, what we can be thinking about is that if I put a lead on one side of the area, and I put a lead on the other side of the area, this is going to allow me to have some high energy or high frequency energy that comes across the spine here and can help my brain perceive this as less of a threat. That's a really important idea, that I can get this immediate pain relieving experience. But the additional follow-up, and one of the things that makes the OTC so incredible, is that we can then have lasting pain relief that can last 2 or 3 hours after a single session. So the key is the first time you've done this, and hopefully you've set this up before you've had your surgery, but we never need to kind of directly go on the surgical site. And all we need to do is go to the left or to the right, and if you just put it right in the meat of the back, that's great. One of the things that we try to do is we never ever have ourselves dial this up. We want our patients to be able to control this. So I'm going to set this up for him though. I'm going to turn on the power. I'm on the gray lead. And so on this side, I'm going to select high frequency. And then I'm going to hand this to Sean and say, dial that up until you feel a comfortable buzzing across your back. You feel a sensation. I don't mean to color what your experience feels like, but I just want you to dial it up until you feel some kind of comforting impulse or comforting feeling across the back. Now, in this situation, what we don't need to do is turn it up high enough where these muscles go into tetanus. So dial that up for us, Sean, where you can see all of a sudden that the muscle kind of goes into contraction. You'll see that there's a moment where he gets really tight, and it's starting to happen here. Go ahead and back that off. So now he's softened up. We don't need it to go into full lockdown. What you need to do is just turn it up till you feel comfortable. And there's a couple caveats here. One is, don't pay attention necessarily to the number. That's just a relative sort of gauge of the amount of energy potential left in the system. Based on how sensitive you are, based on how congested you are, based on sort of nervous system readiness and arousal, It may be different levels at different times, even different pad placements. So don't worry about that. It's all relative. But what we want you to do is to adjust till you feel comfortable. The pad placement and the therapy should never cause you discomfort. It should feel like, that's a relief. I've been looking for that. And then the other thing to remember is that during the course of a typical 45-minute session, which is how long we recommend people do this, that we may need to add impulse or add energy to the system as people are accommodating. So as you know, you've been doing this for 20 or 30 minutes and all of a sudden you're like, hey, I can take a little bit more. You can dial that up as you become more comfortable with that. What we want you to do, though, is this is important, is that anytime you're using high frequency, because we're putting energy into the skin, will you turn that off for me real quick? We want to make sure that we're not having any redness or irritation. A little bit of red underneath the pad is okay. That's because we're putting some energy into the system. But what we want to make sure is that after 45 minutes or so, we give that area a break. Generally, it's a good idea to have a short dose and a short response. So I do 5 minutes, and someone could check the pads, and hey, your skin looks fine. You're not having a reaction to that. But after 45 minutes, what we'd rather you do is go ahead and take a full hour off. And if you're continuing to have pain-relieving benefits, go ahead and expand that and wait and delay your session until you feel like you need that on-demand pain relief. So we can be right through there in that situation. What we don't want you to do is think, hey, I'm going to put these pads on and keep them on the whole time. What we're trying to do is give you a break in how you're feeling, some immediate on-demand pain relief, and then let your body use that window of opportunity to go move in your environment, go take care of yourself, wash your hair, use the washroom, walk around. But can I use this window of opportunity where I'm feeling better to do something else? Really just keep that in mind. And that may be just taking big breaths or falling asleep, whatever it is that you need to do. Now, a couple other pad placements that's worth talking about is that I can simply go high-low across the spine here in the area where I've had my surgical input, and I may need some help, so hopefully you have some help. We just don't need to cover the spine. So this is one setup where I've gone low, low, high, high, but we can also make a cross. So now I've done is just switch the pads so that I have a high pad and a low pad on each side. This is basically focusing an X on a potential site or an area where I feel like I want a little bit more sort of attention. And remember, what's happening is that the energy is going between the pads, so between the leads. So in this situation, we've got high setup on both situations. And it doesn't have to even be equal. He's like, hey, I feel comfortable, good, let it go, and enjoy that on-demand pain relief. The key here is this. We want to give you a non-drug intervention to feel better, that you can be repeated multiple times in the day, and that you're understanding that this creates a window of opportunity to do your rehab. This creates a window of opportunity to take care of yourself or do your ADLs, and more importantly, can be repeated for as long as it takes for that brain to start to recognize that this back is a friend and not a foe. And for some of us who are having back surgery after long periods of chronic pain, it's going to take a second to help disconnect that brain potentially from what's happened here. And what we can do is keep coming back to the on-demand pain relief to help break that pain cycle, that sort of connection between brain and body. I have a window of opportunity to move pain-free or feel pain-free, time to go move and load appropriately. So again, these are some of our basic recommendations for how we set up the spine after surgery. Get a dose, get a response, make sure that you're feeling okay, and use that opportunity to do something that makes you feel better around movement.